Hi guys, the Health Minister Maria Caulfield, who used to be a nurse if you believe it, but is now a Tory MP and a minister, seems to believe that nurses don't deserve a pay rise. So much for looking after your own. She now seems to care more about multimillionaires and billionaires. Anyway, she was challenged by Niall Paterson of Sky on the issue of nurses' pay. Now, this was correct, but sadly there was a wonderful moment here that Niall missed to really corner the minister. Have a listen to this.
And that's why it is with regret that we see that the RCN are going out on action today. You absolutely understand the issues around pay, and I've explained what measures we took around that. But the Secretary of State did meet with the RCN earlier this week to talk about some of the other factors that make life very difficult for nurses on the front line.
If Steve Barclay had sat down this week with the nurses and discussed pay, not the other things, but discussed pay, the strikes would have not have gone ahead today.
Well, I don't necessarily agree with that. We can't...
So you think the RCN were lying when they said, if you sit down with us and talk about pay, we will not strike?
No, I don't think I know Pat Cullen very well, and huge respect for Pat. I don't think they were lying, but the demand of 19% is not something we can realistically deliver on.
They made it perfectly clear at the weekend that, yep, they had suggested 19%, but that they would be willing to negotiate. They would even perhaps have been willing to take that figure of 7.5%, which has worked in Scotland, which is why they do not have nurses striking.
So in Scotland, they have suspended strikes, but that deal hasn't been agreed. They've put that to their members. The RCN aren't actually recommending that deal to their members, and we won't know the outcome of that till the 19th of December. So
but they're not striking, are
they? They're not striking today, but they haven't resolved the dispute in full. And we have, for every percent that we agree for the nurses, or for anyone else, in fact, that's around £700 million that we have to find. And as a government, there's only three ways we can find that money. We either have to borrow it, and we know the impact of borrowing when governments can't afford it. We saw that just a few weeks ago. We either have to put taxes up for patients and
or
residents.
Not waste £30 billion on useless PPE. I mean, the thing I don't think many people...
Now, this is the opportunity he had. There was a clear goal there. Clear open goal, challenge her on the PPE. And you can challenge her on other things. So what the Health Minister and the Health Secretary want is the nurses to take a real terms pay cut. And the response and the reason for that is because we can't afford to pay you any more money. But we could afford to waste money, £30 billion on PPE that was completely useless. We could waste £37 billion on a test and trace system that we handed over to Dido Harding, who was incompetent. We could afford to write off between £8 and £9 billion in fraud. We could afford to do all of those things. We didn't care about clawing back any of that money. We have a member of the House of Lords who was given a contract. Corruption, pure and utter corruption here. So we can afford the corruption, but we can't afford to pay nurses more. Nurses who are at burnout levels. Nurses who are going to food banks. Nurses who are struggling. We can't afford to pay them a bit more, but we can afford corruption. Yeah, corruption is good, is always affordable. But paying people a decent wage in order to survive. Nurses are not expecting to become rich or anything. They're not expecting to be able to buy new cars or something. They're hoping that they can earn enough to survive, and also that it will stop the outflow of nurses who are leaving the profession and leaving those existing with a higher workload. That's what they're asking for. It's not much. And the response from the minister, oh, we can't afford that. Once again, there was a real opportunity here to grill the minister on that. And I would have said, OK, the £30 billion wasted. What about that? Why aren't you clawing that money back and giving that to nurses? What about the £8 or £9 billion that the former Chancellor and now Prime Minister wrote off in fraud? Why aren't you clawing that money back and giving it to nurses? No, you want nurses to go to food banks. And you won't impose new taxes. And she talked here about, well, you have to borrow. We borrowed for the PPE. There was borrowing for PPE. What about imposing higher taxes on the multimillionaires and billionaires? who can afford it. Ending non-dom status. You won't do that. Let me know in the comment section, guys, what you think about all of this. As always, your comments are greatly appreciated. Thanks a lot.